Good morning, everyone. I really welcome this announcement today. This is a government that listens. We've been in very close dialogue with the Deputy Premier over the last 2 or 3 weeks, Gus Cleland and myself and others, and we are extremely grateful for this pretty decisive action today. As Deputy Premier said, here in Victoria we've been dealing with a system that's been overwhelmed in mental health for years. The issues that people are raising about hospitals being overwhelmed with COVID cases, that's our daily life in mental health. It always has been. And the Royal Commission is the solution to that in the medium to long term. And once again, this is the only government in Australia that's actually taken that decisive action. However, there was a big hole in between the Royal Commission starting to change things and turn things around and the emergency situation that we're dealing with now in Victoria on a daily basis, with young people in particular being turned away on a daily basis from emergency departments in life-threatening situations. Now, the combination of the Deputy Premier's focus on young people and education and mental health is a very important one, because he realises that we have to address this issue. So this approach today is a whole of lifespan, but the people that are really suffering at the moment are the young people and their parents. So the parenting program is also very important. Young people can't survive and flourish unless the scaffolding around them is strong and able to cope. And we all know that the parents of Victoria are really struggling at the moment. The teachers are, the mental health workforce is as well. So a government that focuses on mental health and physical health at the same time is a rare beast. And that's what we're seeing today, a government that has both those issues in mind, and we are grateful for that. It's never been seen before. So it is a stepping stone. There's a big task ahead. It's not going to be a total solution, but it will set the scene for progress next year as the Royal Commission starts to take root in the community. The community is where mental health care has to be provided, close to people's homes, but with expert care. It's not a game for amateurs. Mental health care is a very complex and specialised area, and the cases that I see every day are in that category. We need team-based care to help them, and we need expertise. We need to grow that over the coming months and years. We can't wait for 4 to 10 years into the future for this to be solved. It's an urgent problem, and I think the government's announcement today recognises the urgency of the situation. We've had trouble getting that message through nationally, the urgency of the mental health crisis, the shadow pandemic, as we've called it, and so we very warmly welcome this announcement today. Thank you very much. Do I hand over to you now?
Yeah.
Yeah.
Good morning. Good morning, everyone. On behalf of the mental health sector, I'd like to thank the Victorian Government and the Department of Health for being so responsive. It was only a few weeks ago that Pat and I started discussions with Health and with the Minister around options to address some of the immediate to short-term needs of the community, and it has been particularly heartening for us to see such a rapid response. The package that has been announced this morning will provide an enormous level of support to people within the community, within Victoria, and it will draw on the strength of community health and community mental health organisations across the state. And they are in many ways the unsung heroes of the mental health sector. We will see support reaching out across the state, which is absolutely fantastic, and tailored particularly to the particular needs of local communities, and that's part of the strength of community health and mental health. They know what's best for local communities, they're hooked in, and they understand local conditions and local needs. We are really very pleased that this has been announced today, and as Pat says, it will act as a bridge to the broader reforms that will start to come online from the middle of next year. One point I would like to make, though, of course, is that mental health is a dual federal and state responsibility. We gave the Commonwealth top marks last year for their very quick response a year ago in September, and the establishment of a program across the state. But conditions have changed very considerably since then, and we call on the federal government to at least match the commitment that's been made today and roll out additional services on top of what's already been committed. Thank you very much indeed.